Fry. It's Audrey Button, Safe Harbors of the Finger Lakes College Specialist. I am here with a special guest. We're going to be talking about FREs, which are forensic rape exams. So I'll let her kind of go into that and introduce herself. So I'm so excited if you're tuning in right now. If not, you're watching this at a later time. So I'll go ahead and let her introduce herself.
All right. I am Cassie Henry. I'm a nurse at Thompson Hospital, and I'm a sexual assault nurse examiner.
So with that, I'm going to let Cassie kind of go ahead and start. This is just going to be a simple conversation. I'll kind of hop in where I need to, but Cassie's the expert here in this stuff, so I'm going to let her take it away, okay?
Okay. So state nursing is basically just extra training that you can get once you are a registered nurse that gives you the ability to do some extra evidence collecting and providing extra support for patients after they've been assaulted or in a case with domestic violence, for any age really. The main thing that we want to express from our program is that no one has the right to your body other than yourself. So sorry, my daughter's here. Being assaulted takes so much from you, and we really want to give that back to you. It's not our job to judge. We want to make you feel comfortable and assist you in gaining parts of yourself back. Our primary job is to make sure that you're physically taken care of, and that you're pointed in the direction of the right resources, like Safe Harbors of the Finger Lakes. The exam is to address the healthcare needs and wellness, and evidence doesn't necessarily have to be part of that if you don't want it to be. We want to treat your physical injuries and to make sure that if you want medication, prophylaxis for STIs, or if you have any specific injuries, that we can help you with that. Exams don't require law enforcement for evidence collection, but they do require a police report to get them transferred to the crime lab for testing. So nothing gets tested without law enforcement, even for date rape drugs, because we don't do that at Thompson. The timeline, you can have evidence collection within 124 hours, but we also can do an exam at any point. We want to make sure that you're taken care of, so it's not necessarily all about collecting evidence or any of that sort of thing. For HIV prevention meds, it has to be within 72 hours. And you can always call.
Here, I can. Somebody's getting a little grumpy. So yeah, no, just like Cassie was saying, you don't have to report to law enforcement, but if you do, that's where we kind of come in from Safe Harbors. So if you want to report to law enforcement, we would help you along that process and what that would look like. And if you want to make that criminal report, we could do that. And obviously, if it's family related, through family court, we can also go down that avenue. But it's an option to decide if you want to report to law enforcement or not. So I'll go ahead and let Cassie kind of finish going if she's ready.
So the actual exam, the process is that you can come in with law enforcement, or you can come right to the emergency room. Thompson is a center of excellence, so that means that we have a same nurse on call 24 hours a day, 7 days a week at this point. So you can have your exam. One of us has to be there to take care of you, and we will then, at that point, we can refer you to other services. So you are welcome to have an advocate. We can call you an advocate before we ever get started with any sort of exam. You can be seen by a doctor in the emergency room if you have physical injuries that require any treatment at all. And then the exam itself is basically just, there's a box that is just the same for every person, so it doesn't necessarily mean that each piece of evidence will be collected. If there at any point there isn't anything that you want done, then you are completely in control at that point. We want to make sure that you know that there aren't things that we're going to do to you without your consent. We will always ask you before we do anything, and we want you to know that this isn't to make you feel uncomfortable. We want to help you get yourself back. What else can
I would say, I mean, definitely like that. Their role is to be there to support you in your health and well-being, to make sure you're okay. And like Cassie said, you can have an advocate there with you, or if you just want to call us or whatever is going to make you feel supported. I mean, as an advocate, our role is to make sure you ensure you know those rights, and they're going to tell you those rights as a patient there. If you want to skip those steps, pause at any moment, you're having a hard time, they're going to be explaining that all along the way. So, you know, that's just definitely really important to know if you're going to get any sort of, just getting that medical care is definitely really important. So I don't know if there's anything else that you can think of, Cassie?
One of the other aspects that people will sometimes get anxious about is the cost of the exam. It is covered.
OVS, so that's the Office of Victim Services in New York State. So yes, the exam should be completely covered. If for any reason they are billing your insurance, then that's something we can help get reimbursed and look at. But OVS, the Office of Victim Services, cover the exams in full. So that's nothing you have to worry about. And same with the medication. So they'll cover the cost for 7 days of the medication, and then after that, any other medication you need, we can help get reimbursement from OVS as well. So that's not something you should have to worry about. So that's something we can definitely go over with you. But if cost is a concern, that shouldn't be a concern because we can have that covered.
And your privacy is also guaranteed too. So if one of the things that would be keeping you from coming in to be seen or have an exam, it's all completely confidential. You don't have to give your insurance information. There aren't any rules about who you have to tell. This is completely up to you and who you want to share it with.
Exactly, and it's just meant for you to feel empowered in making your own choice and making you feel okay with your own body, especially after something like that happening. So, you know, our FRE program with our senior nurses at Thompson are a great resource for that and making sure that you are okay, and they're a wonderful resource. So I don't know if there's anything else, but if there's any questions or concerns about the SANE program or what FREs are, what that looks like that we didn't cover, just have any questions in general, definitely feel free to reach out, definitely to Safe Harbors, and we can get you in contact with the SANE program. Or if Cassie has some contact info she wants to provide, she can do that too. But our 24-hour hotline is 800-247-7273, and you can always go to our website, which is www.shflny.org. And you can always direct message us on social media too. So I don't know if Cassie, you have any information you want to give to wrap up? No, I think you're good. So if you had any questions specifically for the nurses, you definitely can reach out to us and we can get them in contact. So thank you all so much for tuning in. I appreciate it. I hope you all have a great weekend. All right.